Hello, I am Dr. Hemanth, Surgical Oncologist at Vydehi Cancer Center. Today I'll be talking a few words about what we call as Enhanced Recovery After Surgery, otherwise called as ERAS, abbreviated as ERAS. So, cancer surgery has traditionally been considered as a long drawn process and a very painful process. But this traditional surgical doctrine is changing, and it's being replaced by an emerging concept which is backed by evidence also, called as Enhanced Recovery After Surgery. It is abbreviated as ERAS. So what exactly is ERAS, or fast track surgery as some surgeons call it? So it is a process or a program in which the patient is optimized before taking him or her for the concerned cancer surgery. So this process begins not necessarily after admission. So the process begins from the time of the first consultation with the cancer surgeon itself. So it begins from there, and it involves a lot of pre-surgical counseling, assessment of nutrition, whether the patient is nutritionally adept at tolerating the concerned surgery, and whether cardiorespiratory functions are adequate to tolerate the surgery, and many such parameters are included in the ERAS. So how is it different from the traditional surgeries? So unlike before, where patients had to be kept NPO, as we call it, nil by mouth, for a long duration before surgery, in this we reduce the duration of fasting to as minimal as possible, as much as safe for the anesthetist to give anesthesia, which is generally considered to be 4 to 6 hours. So fasting for more than this duration prior to surgery is considered detrimental and has a lot of physiological changes, which has a huge impact on outcomes of surgery. So we restrict the pre-operative fasting, and the same holds good for the period of nutrition following surgery, in which we start oral feeds as soon as possible, sometimes as early as the day of surgery itself or the immediate first post-operative day. And second major component in enhanced recovery after surgery is what we call as an epidural anesthesia. So the anesthetist puts a small pipe in your back through which you will be given analgesics throughout the procedure and following the procedure too for a day or two. So this makes the patient absolutely pain-free. So pain is one of the major factors which contribute to prolonged hospital stay, poor cardiopulmonary effort post-surgery. So with this epidural analgesia, which is given for all patients who undergo either a surgery of the chest or of the abdomen, it causes a huge difference, and patients are generally pain-free on the first day of surgery itself. So, and also another important factor in this is we avoid all kinds of tubes. Tubes, traditionally there are concerned with cancer surgery are tubes in the nose, for example nasogastric tube, tubes in the abdomen following surgery called drains. All these are removed as soon as possible. Sometimes we avoid drains completely following an abdominal procedure. And also we remove the urinary catheter very early, because of which the patient is forced to ambulate, and because the patient mobilizes, he or she is confident that they are able to walk around and they can manage by themselves once they go home. So early mobilization is a very important factor, or a very important part of enhanced recovery after surgery. Secondly, coming to another concept called as early oral nutrition. So we allow the patients to have oral food as early as is deemed safe. Sometimes as early as the day of surgery, post-op day 0, or on the post-op day 1. So the concept of keeping the patient fasting even after surgery for 3 to 4 days is now considered to be unscientific. So these are a few things which are different from the traditionally described cancer surgeries. So what are the advantages? So why is all this being done? What are the advantages of it? Most importantly is reduced hospital stay. Patient can go home quite early. Early discharge is a very important component of ERAS. Earlier return of bowel function. So by keeping the patient in a nil by mouth, the bowel takes a lot of time to recover to its pre-surgical function, and patients have to wait till they pass platters or stool for about 5 to 6 days following surgery. That is an old concept now. We initiate early nutrition, early return of bowel function, improvements in cardiorespiratory function. Like I told you, an epidural catheter contributes a lot towards improved pulmonary functions post-surgery. Early resumption of normal activities. So when the patient is pain-free, she resumes the normal activities very early. They start walking around on the first day and they're confident of going home and getting back to normal life quite early. So can these eras be followed in all types of cancer surgery? So we at Vydehi Cancer Center, we follow these eras protocol. We have a set protocol, set guidelines for all surgeries of the cancer affecting the colon, the rectum, the stomach surgeries, surgeries on the pancreas, and a lot of gynecological oncological surgeries, that is cancer of the uterus, cancer of the ovary, cancer of the cervix. So to put it in a nutshell, surgery for cancer is changing. It's been a paradigm shift from long drawn process, painful process, to a shorter duration of admission, early discharge, earlier return to normal activities, and with set protocols which are backed by evidence. So this has tremendously changed cancer surgery and patients are benefiting the most. And we at Vydehi Cancer Center are following this enhanced recovery after surgery program for quite a while now, and it's benefiting all our patients. Thank you.